Both Novo and Eli Lilly have both kind of said to investors that they're probably going to be supply constrained for quite some time. And then one thing that also tells you how big the market can be is all these other companies buying their way into it, AstraZeneca, Roche. It just feels like this is a space that's going to keep growing.
Yeah, well, absolutely. And again, one of my other colleagues, Sylvia, interviewed Vas Narasimhan from Novartis earlier in the week. Different set of results, though. We'll get to that in a moment. But one of the questions she asked him is whether they're also looking at getting involved in obesity drugs. And his response was, no, we have other focus. We're not going to try to come out with another, what he said, Me Too drug. But for me, that was quite telling because it just tells you how far ahead Novo Nordisk and Eli Lilly are in this space versus the rest of the competition. It's going to be really difficult for anyone to get involved right now.
Exactly, and a lot of these other large pharma companies are certainly going to try. Although we saw, a phase 2 failure with Pfizer just before the end of the year, and then so the science is still difficult for a lot of these companies. But it's not only that; it's this manufacturing component of you have to build such large-scale facilities to be able to supply the market.
Yeah, and what about M&A deals? Again, a lot of biotech pharma deals went through last year. Do you expect that to continue this year on the back of, again, still continued optimism and excitement about what this new type of drug has to deliver, these GLP-1s?
Yeah, I think investors are certainly expecting more M&A in 2024 across the board, and we saw such a pickup in deal activity really in the fourth quarter alone. Most of our companies have very healthy balance sheets, and all of the management companies have been saying they want to engage in bolt-ons. No one's talking about doing large deals, but bolt-ons, and obesity is certainly top of mind for everyone. Yeah.